So how do you test for allergies? So there are two ways in which allergies can be tested. Firstly is what we call as the skin prick test or the SPT, and secondly is by testing for specific allergens in the blood. The most common test which is always performed across the world is actually the skin prick test. The blood tests are generally found to be more expensive and not the gold standard for testing allergies. So what exactly is the skin prick test? The skin prick test is a useful test done to demonstrate one's allergic tendency. This useful technique is considered as a gold standard for diagnosing one's allergic sensitization. It, however, needs to be performed and interpreted by a trained allergy specialist. So how exactly is this procedure done? The SPT is performed on the patient's back or on the forearm. Multiple drops of different allergic substances, what they call as antigens, will be put onto the skin surface. The skin is then pricked with a special needle which allows this antigen to enter into the skin surface. This evokes a localized allergic response if the person is sensitive to this particular allergen. The reaction is then measured as per certain criteria. This test is simple, relatively painless, safe and quick, and the results can be obtained within 15 to 20 minutes. Children also cooperate with the test and can be conducted for any age group. A lot of parents are worried if this test is so painful because it looks like they're going to put a lot of pricks. But it is not true. The application of the drops and pricks cause an initial discomfort with mild itching. The pricks are also very superficial. Mild pain may be only felt during the prick process. However, when performed by experienced hands, the discomfort is very minimal. A lot of children cooperate with the one who performs the test with very little complaints. So how many allergens need to be tested? The number of allergens need to be tested will be decided by the specialist who's testing them. It can vary from 3 allergens to almost 25 allergens. But it will all be based on the patient's history, symptoms and the local allergies which are found in that area. For example, in India, the most common allergens we test for are the dust mite, cockroach and Parthenium grass. These need to be individualized as per your child's history. So if you suspect that your child could be allergic to something particular, it's important for you to tell your doctor to test for that particular allergen. Many people ask for saying, "Doctor, I'm dust allergic. Can you test for dust particles or for pollution?" This cannot be tested because most of the parents blame the road dirt or the playground mud as allergens, where in fact it is the indoor dust and this dust which contains dust mites which causes this allergy. So what your doctor will be testing for is actually the dust mite.